I'm Dr. Paul Ruff at West End Plastic Surgery, and today we're going to do something a little bit unique. We're going to use deoxycholic acid injectable, which is also known as Kybella. It is oftentimes used for this little submental area, this little stubborn area of fat that people don't like. We're actually going to use it on a couple of unique areas. In particular, in this patient of ours, who's Sam, she works with us. We're going to use it on her elbow right here because she's got a little area that she doesn't like right here. Right on the inside, she's got two little fat pads right here that she also doesn't like. You can see that little bit right there. And she's got a little area right above her belly button. So I'm going to mark these right now, and then we'll go through the injection sequence. This is what we call a cytolytic agent. It breaks up the fat cell itself. So it really works to decrease the volume in those areas quite effectively. I'm going to mark out right the fat pad right here. And these are superficial fat pads. I'm going to mark out this little area. This one's a little bit more distinct. There's got a little spot, so I think I'm going to do a little bit on this side too. All right, and then she's got one little area right above her belly button. So right this little spot right here. And this is not an uncommon little area that people get bothered by. All right. This is an injection. It takes just a couple of minutes. There are specific dosing regimens that we follow that have found to be effective. There's going to be a little bit of bruising potentially, not commonly, but sometimes. Most patients feel a little burning sensation. We typically don't need to do much more than Tylenol afterwards. As far as exercise and activity, she can resume everything tomorrow. She can shower normally this evening. So there's not a lot of recovery. I don't put compression. I don't put ice on these patients. A patient could come in, have their injection. Within about 30 minutes, they're going to be feeling just fine and can go about their day to day. We use a little 30 gauge needle. This is very small. Pinch. 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 She may have a little bit of swelling tomorrow. She doesn't have to avoid anything, but most of the time we recommend not doing anything super strenuous the following day. There have been some people who have described using this to help boost high definition body contouring procedures. We've used this for little lipomas. Those are just little fat collections. How are you feeling?
Oh, it doesn't hurt.
Okay, that's that little area. It's a little tiny 30 gauge needle. It's usually pretty straightforward. And she might have a little firm feeling of this area tomorrow as well. It can feel a little firm for even a few days to a few weeks afterwards. Okay, that's that area. Okay, there's that area. That looks good. That looks good. Nice thing is no bleeding. How does it feel?
Good.
Fantastic. All right. So once again, deoxycholic acid used to break up little areas of fat, can be used more than in just the chin area. It's quite effective. Recovery time is really minimal. We will see her again in about a month and decide if she needs any more.